Hi everyone, welcome back again to Smarter Nursing RN YouTube channel, and today we are going to be learning dosage calculation, still on our series of dosage calculation, but this time around we want to look at IV flow rate. So under this IV flow rate, we'll be looking at a number of things. First of all, we're looking at how to calculate mil per hour questions, and also on IV flow rate questions that have to be with infusion time. And lastly, we are going to be looking at IV flow rate questions that are more related with drip rate and which is usually identified as the GTTS per minute. So the first thing we're going to be looking at today is how to calculate drop per minute questions. And drop per minute question has a very simple formula, and the simple formula is using milliliter all over minute. That is the volume in milliliter divided by the time in minutes multiplied by the drop factor. Okay, so if we already have this in mind, it means that if the volume was given to us in liter, the first step would be to convert it to milliliter. And also, if the time was given to us in hours or even seconds, the best thing to do is to convert it to minutes. And after that, we're going to have the drop factor, which is usually included in the question. So you impute your drop factor, and afterwards you begin to solve the question. So let's take our first question on this topic. But our first question says that the doctor writes an order to infuse a solution. The order reads infuse 1000 milliliter of normal saline over 10 hours. The infusion set has a drop factor of 15 GTT per mil, which is the drop factor. The question says, what is the drip rate in drops per minute? The first thing you want to do in this kind of question is to impute out our figures to aid for easy solving. From our question, we could see that what was ordered for this patient was 1000 ml of normal saline for 10 hours. And our drop factor was, which is the GTT per mil, which is the unit for drop factor, was 15, and we were asked to calculate our drop per minute. All right, so let's use what we have here to solve this question. We said that to solve for drop per minute, we're going to calculate the volume divided by the minute, and the volume unit should be in mil. We do not have any need for conversion over here because the volume that was given to us was in mil. Okay, so let's impute it. We have 1000 milliliter divided by 10 hours. Now we cannot use 10 hours because drop per minute calculation needs the time to always be in minutes and not in hours. So what are we going to do? We are going to convert 10 hours to minutes. And we already know that 60 minutes take 1 hour. Okay, so that's going to give us what? 10 times 60. Converting to minutes multiplied by the drop factor of 15. So bringing that downward, we're going to have what? 1000 divided by 10 times 60 is going to give us what? 600 times 15. Okay, so when we do 1000 times 15, we're going to have what? 15,000 divided by 600. Okay, and when we divide that, that is going to give us 25. Our drop per minute is going to be 25 GTTS per minute. All right, so we're going to take our next question. The doctor writes an order to infuse a solution, and the order reads infuse 100 ml of an antibiotic over 30 minutes. This infusion set is a micro drip set with a drop factor of 60 GTT per ml. And our question says, what is the drip rate in drops per minute? From our figure, we saw 100 ml for over 30 minutes. Okay, so that's going to give us 100. Our volume was already in mil, so there's no need for conversion, all over 30 minutes. And there's also no need for conversion because we already have it in minutes, multiplied by the drop factor of 60. Okay, so what's that going to give us? That's going to give us 100 times 60 divided by 30. Okay, so that's going to give us 6000 divided by 30. When we divide 6000 from 30, we are going to have 200. So that means our drop per minute says what? 200 GTT per minute. Our next question says that the doctor writes an order to infuse a solution, and the order reads infuse 1.5 liter of dextrose over 4 hours. The infusion set has a drop factor of 20 GTT per mil. What is the drip rate in drops per minute? And our next question says calculate how many mils should be infused in an hour. So for my question, we had 1.5 liter of dextrose over 4 hours. We have a drop factor of 20, and we are looking for the drop per minute and also the milliliter per hour. I was able to add the question for milliliter per hour because most times questions involving IV fluid that you meet in your exams, you don't just only meet drop per minute questions. Different times you'll be asked to calculate the milliliter per hour, and that was the reason why I included it. So for this kind of case, we already know to solve for milliliter per hour, which is what I would want us to attempt first. We are going to be dividing our milliliter over hour. But when you look at this question, we have a question rather in liters instead of milliliters. Okay? So we are going to convert liters to milliliters before we solve this question. And if we already know that 1 liter is equal to 1000 milliliter, that means what 1.5 liter will be equal to X. Okay? When we cross multiply that, we're going to have what 1000 times 1.5, which is going to give us 1500 milliliter. Okay, so 1.5 liter is equal to 1500 milliliter. To use that to solve for a milliliter per hour, we're going to have what 1500 divided by how many hours are we working with? We are working with 4 hours. Okay, so 1500 divided by 4 is going to give us what 375 milliliter per hour. Okay, so now that we've been able to solve for our milliliter per hour, it's very important for us to solve for our drop per minute question. Calculating for our drop per minute, we already have milliliter over minute, and we already discussed that for drop per minute, we use milliliter instead of liter to solve our questions. So we're going to use the 1500 milliliter that we got during our conversion. So our answer is going to be 1500 milliliter divided by how many minutes? How many minutes? We're giving our question in hours. To convert 4 hours to minutes, we're going to do what? 4 times 60. Okay? Multiplied by our drop factor of 20 GTT per mil. All right? So for us to divide that, let's make use of what we already have. Okay? So we're going to have 1500 times 20 divided by 4 times 60 will give us 240. 1500 times 20 is going to give us 30,000 divided by 240. 30,000 divided by 240 is going to give us 125 GTT per minute. Using what we got for our milliliter per hour, we can also cross-check if what we got for drop per minute is correct. Okay, so the best way to cross-check is to use these for our order. Okay, so let's imagine that we had an order of 375 milliliter per hour. So 375 milliliter was supposed to be infused in an hour, and we know that 1 hour is equal to 60 minutes. Okay, so we're going to do 1 times 60 times what multiplied by our drop factor of 20. Okay, so what's that going to give us? It's going to give us 375 divided by 60 times 20. We multiply that, we are going to have 6.25 times 20, which is also going to give us the same 125 GTT per minute. Okay, so through this, we're able to see that what we got here was correct and what we got here was correct, because when we use what we got for a milliliter per hour to solve for drop per minute, we were able to get the same answer. Now we're going to be looking for how to solve for IV infusion time. Apart from some questions on the IV fluid that will be given to you, calculating the drip factor or calculating for milliliter per hour, sometimes questions are given to you and you are asked to calculate the infusion time. Okay, so I'm just going to show you a very, very easy way that I solve questions on infusion time. The doctor writes an order to infuse a solution, and the order reads infuse 500 milliliter of dextrose in water solution at 100 milliliter per hour, and you start the infusion at 4 a.m. What time will the infusion be complete? We have that the order read what infuse what 500 milliliter of dextrose in water solution at what 100 milliliter per hour. And we already say that the infusion time was started at what 4 a.m. And now we have to find out at what time the infusion would be complete. The first thing to do is to say if 100 milliliter, we're going to make use of what we already have, is administered in 1 hour, it means that what 500 milliliter would be administered in X. So when we cross multiply that, we're going to have what 100x is equal to 500. So therefore, our X would therefore be equal to 500 divided by 100, and our X would be equal to 5 hours. Okay. Now, we already said that the infusion time started at 4 a.m. It means that the shorthand was at 4 and the longhand was at 12. Okay. So if the infusion started at 4 a.m., the next step for us is to add 5 hours to 4 a.m. All right. So adding 5 hours, we'll have 1, 2, 3, 4, 5, and that's going to give us what 9 a.m. So our answer is the time that the infusion will be complete will be equal to 9 a.m. Let's take our last question under infusion time. So this question says that the doctor writes an order to infuse a solution, and the order reads, infuse 2.5 liter of lactated ringers at 200 milliliter per hour, and you start the infusion at 2100 milliliter time. At what time will the infusion be complete? There's something I want us to note about the military time. And the difference between the military time and the normal time that we know is that while the normal time work on the 12-hour work clock, the military time works on the 24-hour work clock. So what that means is that when we get to 12 p.m. on a normal time work clock, after 12 p.m., the next time is what? 1 p.m. Because we are making use of a 12-hour work clock, which is the same thing we have here. When we have our 12-hour work clock here, okay, so after 12 it's starting back again from 1 to 2 to 3 to 4 to 5 to 6 to 8, and then until we get again to 12. But when we are making use of a military time after 12 p.m., what we have then is 13 p.m. because the military time makes use of a 24-hour work clock. So instead of 12, 1, 2, 3, 4, 5, we have 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, and 24. Okay, so that's the main difference and the major difference between military time and normal time. The first thing we want to do is to convert this from 2.5 liter to milliliter, okay? And we know that 1 liter is equal to 1000 milliliter. Therefore, 2.5 liter will be equal to X. X, when cross multiplied, X is therefore equal to what? 2500 milliliter. Okay, so wherever we were supposed to make use of 2.5 liter, we are going to be making use of 2500 milliliter. So let's use my formula to solve for this. We have that it was supposed to be infused at 200 milliliter per hour. So we're going to get, if it is normally infused at 200 milliliter per in 1 hour. What that means is that for 2500 milliliter, we're going to have what? X. So our 200x, when we cross multiply, 200x will be equal to 2500 milliliter. Okay, so our x is therefore equal to 2500 divided by 200. When we divide 2500 with 200, we're going to get what? 12.5 hours. Okay, and our question says, what is the time at which all of the infusion will be done? Okay, and we already have the start infusion time to be 2100 military time, which is the same thing as 21 p.m. Okay, so now we are going to include 12.5 hours to 21 p.m. This is a physical representation. We're going to make use of this physical representation of the work clock, and I was able to modify it to contain the 24 hours work clock, where we can see that instead of 1 we have 13, instead of 2 we have 14, instead of 3 we have 15. Okay, so if we are supposed to multiply, or rather add 12.5 hours to the 21.00 p.m. which we already have, so it means that starting from 21 we're going to count 12. Now the way this modified work clock runs is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then after 12, it moves down to 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. After 24, it then moves out to 1, 2, 3, 4. So you can see our point of intersection here. If we are going to assume this as a 24 hours work clock, we will always have a point of intersection. So it means that we're counting from 1 to 24, and after we get to 24, we get back to 1. Okay, we don't continue from 24 to 13. That becomes a wrong timing and a wrong way of calculating our timing. Okay, so the first thing we want to do, we're going to separate our 12.5 hours to be 12 hours plus 0.5 hours. Why? Because of the decimal point, and there is nothing like 12.5 hours. So when we separate this, the first thing we want to add to our 21.00 p.m. is our 12 hours. Okay, so let's start that. 1, 2, 3. We are already at 24. So we take through the intersection. Okay, so it becomes what? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So we stop at 12, it's going to give us what? 9 a.m. All right. So it's time for us to add our 0.5 hours. How do we add our 0.5 hours? We have to find out what makes up 0.5 hours, because we know that 0.5 hours is not even a complete 1 hour. So we know that whatsoever we are getting is going to be in minutes. Okay. So when we try to multiply that, we're going to try to convert our hour to minutes to know what we are supposed to add with 0.5 hours. Okay. So we have that if 1 hour is equal to 60 minutes, it means that 0.5 hours is equal to x. So our x would therefore be equal to 0.5 times 60, which is going to give us 30 minutes. So it means that now that we already have 9 a.m., we are going to add 9 hours plus 30 minutes is going to give us our final answer of 9 hours 30 minutes, which is our 9:30 a.m. It means that if this infusion started at 21 p.m. and we were to add 12.5 hours, it means that at the time the infusion will be complete, the right time would be 9:30 a.m. Okay, so with this, I've come to the end of using our IV flow rate formulas to solve questions on IV flow rate. Today, we're able to look at solving for milliliter per hour. We also saw solving for drop per minute, which is the first formula we initially had here. Now we also saw solving for the infusion time. Okay, so you can try out other questions that you can lay your hands on to get yourself more familiarized with solving for IV flow rate. Please like, comment, subscribe, and share to any nursing student that you think would find this video beneficial. All right, see you in the next video.